Can you all see this? I can see Jenny and Anita. Can you? Okay, good. All right. So thank you again to the chamber and for all of you all for joining this morning so we can share about our Certified Community Behavioral Health Clinic and the services we offer there in Bullitt County. One of the topics we talked about sharing today is good mental health during a pandemic. So we're going to talk about that as well, some self-care techniques, as well as sharing with you about the services we're offering here in 7 counties. So I'm going to have Allison Howard and Heather Hodges are going to help me with this presentation today, but I'll get started with a few little self-care tips here. So is good mental health possible in a pandemic when the world is closed? I liked this quote, never give from the depths of your well, but from the overflow. Rumi. Remembering these 3 things can help us all restore our healthy relationships with our regular self-care. That it's not selfish for us to take care of ourselves, that we are not helpful to other people in our lives, whether it's our family or our work, when we're kind of a mess ourselves and we're not taking care of ourselves. And remembering that boundaries are healthy for us. So, working on making sure it's weird when you're working from home to have a start and an end time for your job, but sometimes that's an important thing to really make sure you're doing for yourself. Some more self-care tips here. The practice of taking an active role in protecting your own well-being and happiness during times of stress. So these are things I think we all know, but need reminders. Eating healthy, making sure we drink plenty of water, making sure we're getting good sleep, a regular sleep schedule. Our smartphones are amazing. Mine alerts me when it's getting close to time for me to go to bed, and it shuts off. So if you text me between certain hours of the evening, I don't get it till the next morning. It shuts off so that I can get some good sleep at night. I always tell people if it's an emergency, they'll have to call my husband. And then making sure that we're doing our regular checkups, our health checkups, but also taking care of simple things like I called my doctor last week because I've had allergies and got a prescription for that. So, just taking care of ourselves. I'm going to have some more towards the end of this presentation, but we want to share a little bit about our whole health clinic here in Bullitt County. I don't know if Heather or Allison want to unmute and kind of talk about.
I'll just say something real quick. I'm going to have to hop off because it's my day to do NTI with my 5-year-old. So I'm sure many of you can feel my pain here. But I just wanted to introduce myself, that I'm my role is the project director of the grant. And so am just working to make sure that we're doing all the things that we're supposed to do. And it is really exciting, the level of services we have in Bullitt County through this grant, and trying out the concept of the whole health clinic. So Heather will tell you more about it, but I just wanted to say that. And then when you see me hop off in a minute, you'll know why.
Thanks, Allison.
Yeah. So good morning, everyone. And I am excited to get to share with you all about what we offer here at 7 County Services and with the CCDHC. And so I wanted to go over, specifically individually what services we were afforded because of the SAMHSA grant and because of the ability to utilize those resources and funds that were given to us. And so hopefully through this, we will educate you on understanding what resources are available, discuss with you about how to make referrals, so on and so forth. So if you have questions, you can just let me know or let Gloria know in the chat, and we can kind of go from there. So first and foremost, one of the major barriers that we experience in rural communities is transportation, because oftentimes things are somewhat distanced, and sometimes it takes a village to get people to where they need to be. And so one of the wonderful aspects of our grant that we were given the opportunity is transportation services. And so right now we are in the process of getting things kind of revamped and going again after COVID. Well, it's not after COVID, but with the safety precautions of transportation. And so what that looks like is helping clients to get to any medical appointments, to get to their appointments here at Seven County Services. It's not just for specifically Seven County Services. If they are a client, they can qualify to be assisted to get to other medical appointments and things that impact their overall whole health. And so understanding the biopsychosocial model of how we help them in aspects of their life that overall help their whole health, and obviously their mental health. So that's the transportation service piece. Veteran services is really a wonderful aspect. So at the beginning of the grant, we were all trained and introduced. Some of us obviously have a history of understanding veteran services through our training, and some even through personal experience having served. But the veteran services, we offer that, we open that up, and it's really wonderful because it gives us the opportunity to meet with veterans, to serve them, and to provide assistance to them for their mental health and their overall helping connect them in whatever way to whatever services that they might need. And then the free physical health screening. This is really wonderful because if you're not familiar with ACEs, ACEs are adverse childhood experiences, and so there's really kind of three types of ACEs. You can have environmental, you can have emotional, and you can, oh, I forget the third one. But anyways, I can't think of the third one. But basically, they're events that happen in early childhood that expose us to higher risks related to future issues due to trauma. And so trauma can be in any aspect. It could be natural disasters, environmental, or emotional, based on familial things, and other aspects, and biological, like within us, within our brain functioning. So with the physical health screening, that helps us with our health. And so they will be connected to a nurse that is specifically able to assist them with screening them for their A1C or their blood sugar levels, lipids, which will assist with high cholesterol, and it will also take weight and body measurements. And then what we can do, once we have that data, we have care coordinators, and one of their specific responsibilities is to help and assist those individuals who have more than likely experienced some level of trauma or have ACEs in their life, which has contributed to some of this health issues. So you see the tie-in from the mental health to the physical health. And now we're going to get them connected to a physician, to a PCP, so that they can be connected and then get treatment to help assist in battling and dealing with whatever health issues they may have that are connected within their treatment here at Seven County Services. Mental health, behavioral health services, we offer a wide array of services. So from, I think, as young as 3 or 4, all the way up to 90 plus. I mean, if If you are struggling with mental health and need any kind of assistance or treatment, that is afforded to you through being able to come here to Seven County Services. You would go through our access line to be placed here at Bullitt, and then you would be scheduled. And so on and so forth. And then, of course, you would meet with a therapist and have a comprehensive assessment completed. And then from there, we would be able to assess and see what needs are needed for you. And everybody's needs are different. And so, again, we also offer substance use assessments as well, which again helps to treat the whole person. So the first appointment journey is completing paperwork with business staff, therapy appointments, you meet with your therapist. I think it's really important to remember that this is sometimes one of the scariest times for individuals because, you know, it's a new concept, especially if they've never had any mental health treatment in the past. But we work really hard here at Bullitt and at all of our locations to make sure that when people come in and they are greeted, that they do feel welcomed and that they do feel some level of safety so that they can be able to be fully present so that we can ask the questions that we need to ask to get them the treatment that they need. And then we complete a national outcome measure in order to demonstrate effectiveness. And so basically what is wonderful is that we have data supporting what we are offering. And so we have NOMS, which is the National Outcome Measurement. And what it does is they will meet with the NOMS assessor at the very beginning of their services after they have their comprehensive assessment. And then from there, what they'll do is meet with them at 6 months, and then I believe it's at a year, and then they're able to track progress, which gives us the measurements we need to support the grant that we have. And then meet with the nurse, and again, that goes back to the physical health stuff as explained. And so it's really a pretty awesome well-rounded whole health treatment. And then, of course, at the end, they'll be scheduled for their next appointment where they'll come back and they'll have their treatment plan and then actually begin to work on their journey of recovery. Outcomes for the first 2 years of implementation. We've served 1,951 clients through the CCBHC grant. And so we are very, very excited and grateful for that. More than doubled the amount of addiction evaluations provided. You know, in our nation right now, we have a high percentage of population that are addicted to opioids and other, other illicit substances or substances in general. And so I think it's very, very important that we're able to support them in that. And so that's a wonderful offering that we have here. 31 of those individuals received detox. 88 of those individuals received residential treatment. Transportation provided to 772 individual families, which is really huge because, depending on their socioeconomic level, where they're at, in their life, sometimes the transportation piece is difficult. I mean, not having $5 for someone to bring them here for treatment could really be a barrier. And so to be able to provide to that many families, we are very grateful for the CCBHC grant. Okay, so one awesome and wonderful factor that makes my heart extremely happy, because I'm a social worker by nature. And so it's really hard sometimes when someone is struggling and you have all these restrictions of who can be seen and what, but we can help regardless of insurance type. So we accept Medicaid, Medicare, commercial, TRICARE, and we have also, for those individuals who do not have health insurance, we have a sliding fee scale, and they can call Access, the number that originally I was talking to you about, at 502-589-1100. And they can begin the process of setting up and scheduling their first appointment with us.
Great job, Heather. I've been your Vanna White. I hope I've done okay. Um,
Have been wonderful, Gloria.
Good.
Thank you so much.
You can also go to our website, sevencounties.org, and make a first appointment request there. And you can encourage people to go there if they don't want to call, or if they notice they're having a wait when they call, and then one of our phone counselors will call them back. When they fill that out, it goes to all of our different services and it gets triaged to the right program. Something I learned in my 7 a.m. meeting this morning is we're going to have 6 MCOs, 6 Medicaid programs. Joy could probably tell us this, starting in January, because Anthem is going to continue to be a managed Medicaid program. So we are going to have Aetna, Humana, Passport Molina, WellCare, Anthem, and United Healthcare. So we'll be able to serve all 6 of those Medicaid providers. And there are some, just things you need to know, I guess. Medicare requires a licensed clinical social worker or a psychologist. That is a Medicare requirement. Thankfully, out of Washington, it was passed that other licensed providers eventually will be able to provide Medicare services. It's got to trickle to the state of Kentucky, but it was passed in Washington, D.C. that Medicare will look into accepting other licensed providers. So I'm excited for when that comes to Kentucky. And then commercial insurances require licensed providers. So just so you all know that, but we're going to be able to get that. One of the blessings, I think, of telehealth is, let's say all of Heather's licensed providers are busy at the Bullitt office. We're going to be able to get one from maybe the Shelby office or the Henry Oldham Trimble services or Spencer, or even Jefferson County, to be able to serve them virtually. So that's been one of the benefits, I think, to telehealth. And Heather, I appreciate your optimism of, after COVID, that is going to happen. We'll claim that we're going to get through this. Some more self-care. I put these kind of together based on how much time you have. So they range from anywhere from 1 minute to 20 minutes. So if you just have 1 minute, our breathing is so important. We breathe pretty shallowly. If you watch a baby breathe, their stomach expands and it's such a beautiful deep breath. Somehow we get so busy that we start breathing from our chests. So one thing that's really helpful if you notice that you're stressed is just to notice your breathing. Put your hand on your diaphragm, which is just above your belly button, and feel your belly expand when you take a breath. So if you can count to 4 when you're breathing in, count to 4 as you breathe out, and just take a minute of doing that. If that's all you have, sometimes before doing a presentation, that's something I will do just to kind of recenter myself and get refocused. 2 minutes. I thought this one was interesting. Have a little chocolate. I love chocolate. So having some dark chocolate has been researched that this helps reduce stress hormones in our bodies. So just 1 square, so we don't have a sugar crash, and it helps us be more mindful without doing anything else. So there's your 1 to 2. If you have 3 or 10 minutes, if you have 3 minutes, you can look at a picture. And I did this last night. I Googled images of, I Googled the Nautilus shell because I wasn't sure what that was. It's such a beautiful shell with such different unique designs on it. A fern branch, a lightning strike. These fractional patterns that are in these images can help our minds unwind. I thought this might be a neat thing if you're having a hard time sleeping at night, that you could just look at one of these pictures and take a break from all the multitasking we're doing and just gaze into one of these images. Give yourself, maybe set a timer because you make it so meditative that you forget to come back to whatever you were doing. But this has been researched that it reduced the stress response and was 44% lower than when they looked at the controlled image. So I thought that was neat. If you have 10 minutes, do something crafty. There was a study in the Journal of Nursing Scholarship that found that arts and crafts help relax people who are caring for cancer-stricken relatives. So if you don't know how to knit, maybe just do one of those adult coloring books. That could be something that could help you. I know Debbie probably gets to do some of this kind of stuff in her work. And that is one of the blessings, I'll tell you, of being a therapist. You get to do a lot of crafty stuff when you're doing therapy, and it's helpful. And we found some creative ways to do it over telehealth too. That's been really amazing. I've been impressed with our clinicians, how they're still able to connect with kids and adults through expressive techniques, even over virtual. You have 15 minutes. Brew some green tea. Green tea. It has amino acid derivative, theanine, that has shown an impact in our alpha brain waves and promotes a sense of relaxation. This was from the Superfoods prescription diet book. Chamomile has also been found to ease symptoms of anxiety. And that's something that's definitely been heightened across our whole world. Anxiety, what's going to happen and how are we going to make it through this, and are we going to make it through this? So, you know, this is, I think, just an easy thing that we can do even when we're on a virtual meeting. Just drink some green tea or some chamomile. Even the compounds in black tea may impact neurotransmitters in the brain. People who drank 4 cups a day for 6 weeks had lower levels of cortisol after a stressful event than a control group did, according to a study in psychopharmacology. And then this is one of my favorites. If you have 20 minutes, go outside. You can do the breathing one and breathe in some fresh air, a deep, good breath, along with just getting some good vitamin D from the sun. But taking a walk can increase our levels of norepinephrine, a chemical that helps the brain deal with stress. And doing light activity outdoors has been shown to greatly boost a person's mood and energy. So this gives you an excuse to go out and do some leaves and enjoy it. According to researchers at the University of Essex in England. If you can't stop ruminating, consider listening to a podcast while you're out for a stroll. So yeah, if your mind is stuck on something that's really disturbing you, try to pop on a positive, maybe TED Talk that you've been meaning to listen to, or if you missed the virtual sermon on Sunday, listen to that as you're taking a stroll. So if you have any questions after this, I mean, I know we're going to take some time for questions this morning, but if something else pops up, I wanted you to have Heather and Allison's email addresses that you could reach out to.
That picture doesn't make me look very happy.
Heather's a very happy person.
I am an extremely happy person. And as I look at that, I'm just like, oh my gosh. And one other thing that I did want to add, because I do think it makes a smidgen bit of difference, is I am a licensed clinical social worker, but I'm also a licensed a licensed certified alcohol and drug counselor. And so I'm an LCADC as well. So not that that really matters all that much in the grand scheme of things, but I do have training in both areas. So both with mental health and with SUD or substance use. So just those two pieces. But I'm a happy person, so don't feel like you can't ask me anything.
Heather has this incredible journal that she was sharing in one of our managers meeting yesterday about self-care. Do you want to talk about that journal as well?
Oh, absolutely. So, you know, as as a mental health provider, I've been in this field for almost around 14 years. And so sometimes, sometimes it is really super stressful, and it's very helpful to have ways to break things down and to process things and to deal with stuff, because here at a CMHC, things are always moving. There's always some level of change. And that's not always a negative thing or a bad thing, but it can be very like fast paced, So there's two things that I want really quick, Gloria, I'll hurry. One thing I keep on my desk at all times is my Dr. Teal's body lotion and it's lavender. And so if I need a minute to just kind of get my thoughts together, I will pump a few pumps of that, and I will, massage that into my arms and my hands. And I will use the smell of the lavender and take some deep breaths, and it's very helpful. So that's always something that you can do kind of quick.
You said Dr. Teal's lavender?
Uh-huh. Yeah, Dr. Teal's body lotion, lavender. You can get it in most like Walgreens, wherever. And it's just something that I do. Or if you really want to get fancy and spend money, you can go to big Bath and Body Works and do that. But anyway, I'm kind of a cheapie. So anyways, so there's that. And so the book that I use that I just started, I started this at the end of not the end of November, good Lord, the end of September. And it's a 90-day journal, but it's really powerful and wonderful. It's called, I don't know if you can see it, but Self-Care, a Day and Night Reflective Journal. And the reason I like this is it's repetitive. So every day it's some of the same questions, but it kind of forces you in a positive way, not in a negative way, to look at how can I treat myself better? What can I do to help myself improve? And to really be mindful of how I treat myself, right? For self-care. And so I know it's hard to kind of see, but it starts out with what is my intention for the day? How much sleep did I have? Did I have any bad dreams, any good dreams? And then you can do some general notes or whatever. And then what did I eat for breakfast, lunch, dinner? It has a whole thing broken down. How many cups of water have I drank? So I didn't realize before I started this journal how little I drank water. Because I think, I fill my tumbler up like twice a day. No, that's not what you're supposed to have, like 6 to 8 of those a day. And so this really helps you keep track of that self-care piece. And then how much exercise are you getting? And then other activities, it lays out like different activities that you can do for yourself that really provide self-care and good headspace for you. And then you record how you physically feel, things that were fun or relaxing. Sometimes it's really nice at the end of the day to look back and say, okay, what was fun or relaxing? Sometimes you find, well, I don't know that I really did anything fun or relaxing. Well, instead of judging that, look at it as a way to learn. Okay, so what tomorrow can I do to help me have fun and relaxation in my life? What are some harder, stressful things that I faced today? Kind of things I did for myself. And then at the very end, it gives you 4 little sections where you can write in and kind of track your mood throughout the day. And so it's really a wonderful tool. And you can get it on Amazon for like $17. But it really kind of gives you the ability to look through things every day and to be able to go back and reference and see how much you've grown. And it's really a wonderful journal.
Thank you all again for just allowing us to do this, and I will open it up, I guess, for questions now. Anybody has any questions?
Okay. All right, perfect. Everyone's welcome to unmute their line. Thank you so much, Gloria. That was great. And Heather, what was the name of that book?
The journal?
Or the journal?
You can go on, if you are like, I'm an Amazon Prime person because I like to shop. But I'm also very frugal in some respects. So anyways, but it's super inexpensive in the grand scheme of things. And it's oh, it's cutting out. Self-care. Oh, that's not nice. Self-care. A day and night reflection journal. And so I don't like this. Like you can't see what I'm doing. Like,
Heather, if you turn off your background for just a minute,
okay. I was
it'll show.
This is not playing very friendly. So let me turn this off really quick here so that you guys can see what's up. Let me see, none. Okay, that's what I want. All right. So now you guys just get to see my natural environment here at the office. But yeah, so self-care, literally this is the title, self-care, a day and night reflection journal. It's wonderful. And I think, and of course, I'm also a big believer, and I know, I feel like I'm telling you a whole lot about me, but anyway, I'm a color person because I think colors set moods and make people really excited or happy or content. And so anyways, in my office, I treat myself to my Sarista markers. Aren't they just beautiful? And so anyway, so like if I'm working a report, something that somebody doesn't need, or it's not a legal document where I need to sign in black ink, I will be playful and I will use my colors. And, you know, I know it sounds silly, but it really brightens my day. And so that's another thing I do for myself, because the jobs that we have here are very stressful, as I'm sure many of your all's professions are as well. And so it just gives it a little extra pep in the step of the day. So, you know, just something fun.
I love markers.
I know, they are so much fun. So anyways, so yes. Any questions for me? Any questions for Gloria? I mean, we're here for you guys. I know that we kind of sit off in the back of a, you know, kind of an off-beaten path here in Bullitt County, but you know, you got us. So what do you have questions for us? Anything. It could be any, you know, within reason, I guess, but it could be anything. So what do you have for us?
Gloria, I have a question. Have you ever been a yoga instructor?
You know, it's so funny. I love yoga and I like exercise. But for some reason, I always have to have an instructor because it's like I don't remember what I'm supposed to do next unless somebody tells me. But I do enjoy those things. Are really important for my good mental health. When I'm not doing them, my family knows.
I think you'd make a great one.
Oh, thank you. We're definitely open to hear if you've had any challenges with working with us or know anybody who has. Definitely, we love to hear about successes as well. But one of the things that we're excited, I wrote down something Heather said, we have everybody in their organizations have their own lingo. CMHC stands for Community Mental Health Center. And so we're charged, you know, to help the mental health in our community. And we feel, I think, very fortunate and blessed to be able to do this work. And I personally, and I know Heather would say this too, really enjoy the work we do in Bullitt County. It's just a great community, very caring people. You know, Anita had to correct me in something I did, and she did it in such a kind way. And just, you guys are just really lovely people. My parents